Hi there, I'm Dr. Barrett. I'm going to be your host today for the Medicare Made Simple discussion. If you have a question at any time during the webinar, please you can let us know by clicking on the little Q&A button, which is at the lower left side of your screen. All right, I think we'll get started. Village Medical is a primary care provider focused on changing healthcare to make it easier for our patients to get well and stay well. Our doctors and advanced practice providers, nurse practitioners, and physician assistants lead a whole care team who are dedicated to helping our patients get more time, more attention, and more help coordinating their healthcare, because that's how we keep patients healthy. We keep you having a high quality of life and out of the hospital. We believe that healthcare should be personable, accessible, and coordinated. Um, and it should be designed specifically for you. As an individual person, you should be getting individual care within general guidelines and recommendations. We see in our clinics, we're experts in treating patients age 65 and older, and we also see patients of all ages. We're excited to partner with FOB Insurance Brokers, a local insurance broker located in Spring, Texas. FOB Insurance Brokers helps its clients understand health insurance options and enroll at no cost. So you can receive a no cost recommendations from FOB Insurance Brokers. All right. We'd like to take a moment to introduce ourselves. I'm Dr. Elise Barrett. I'm a family physician. I grew up in Columbus, Ohio, and I went to the Ohio State University for undergrad and the Ohio State University College of Medicine for my medical degree. I did my residency in Columbus, Ohio, at the same hospital where I was born. After that, my husband and I decided we wanted to seek warmer climates in a friendly multicultural city. So we chose Houston, and we've been down here since 2011.
Thank you, Dr. Barrett. Good afternoon. My name is Mitch Irvin with FOV Insurance. I'm truly honored to be here today and would like to extend a sincere thank you to Dr. Barrett and the entire team at Village Medical for giving me the opportunity to speak with you today. I specialize in Medicare solutions and take pride in helping individuals navigate through their Medicare options with clarity and confidence. My goal is to ensure you feel informed and empowered when making decisions about your healthcare coverage.
All right. So let's get started. Um, Today, we're excited to talk to you about the basics of the Medicare Annual Enrollment Period, also known as AEP, and the options available to you. Each year, between October 15 and December 7th, eligible recipients have the opportunity to change Medicare coverage. Specifically, we'll discuss with Mitch Medicare coverage options and tips for enrollment. All right, before we dive in, we want to hear from you. Where you all are in the process of getting signed up for Medicare or advancing into your annual enrollment period. You're going to see this poll pop up that's asking more about your understanding. Tell us how you're feeling, because we want this webinar to provide helpful information to folks at all stages of their Medicare journey. All right, so please choose from the following. This is my first annual enrollment period, and I'm not sure what to expect. I've gone through the annual enrollment period in the past, and I find it difficult to understand. Or I feel okay about the annual enrollment period, but I would like to learn more. Or I feel confident going into the annual enrollment period this year.
Great questions.
All right. So we've got lots of newbies. We've got some people that are pretty familiar, and it looks like we have a nice mix. So Mitch, you're going to have lots of questions to answer.
Nice.
All right. Thanks for participating in the poll. Throughout this webinar, we'll ask questions to make sure the information we share is most useful to you. First things first, before starting this process, we want to make sure you are eligible for Medicare. Mitch, can you share who is eligible for Medicare?
Absolutely. Medicare is a government administered health insurance program for people aged 65 or older, or individuals under 65 with certain medical conditions or disabilities that qualify under government rules. Now, you may qualify for Medicare early if you have a qualifying disability such as end-stage renal disease or ALS. So that's typically the only way you will apply for Medicare before the age of 65. Unless you have a qualifying condition, you are first eligible to apply for Medicare 3 months before you turn 65, the month you turn 65, and up to 3 months after, meaning you have a 7 month period to apply. So I would highly suggest that most folks apply in that first 3 months, and I'll tell you why here in a little bit. If you still have health insurance through an employer, you can continue that coverage instead of switching to Medicare. Whether you should switch from your employer's health insurance to Medicare really depends on your individual circumstances. Medicare plans can be a cost-effective option, particularly if your employer's plan has a high deductible or monthly premium.
Thank you so much, Mitch. I really appreciate that. So,
Anytime.
Mitch, in my practice, many patients seem unclear about the plan options under Medicare. Can you detail them for us?
Absolutely. Medicare is made up of parts, with each part providing specific healthcare coverage. Original Medicare, or often referred to as traditional Medicare, consists of parts A and B. Part A, also known as hospital insurance, covers inpatient care in hospitals and certain skilled nursing facilities as well as hospice. Part A is free if you've worked and paid Medicare taxes for at least 10 years or 40 quarters. You may also be eligible because of your current or former spouse's work. Part B, known as doctor and outpatient insurance, covers your primary care doctor, specialist, outpatient care, durable medical equipment, and many preventive services such as screening, shots, vaccines, and annual wellness visit. Most people pay a monthly premium for Part B. The exact premium depends on your income level. The base this year is $185 a month. In general, original Medicare pays 80% of covered health care costs, and you pay the remaining 20%. And it does not include prescription drug coverage, but you can choose a separate prescription drug plan if you choose. To help cover the gaps that original Medicare does not cover, you can purchase Medicare supplemental insurance, also known as a Medigap policy, which is sold by private insurance companies to help cover these gaps. Original Medicare does not fully cover like deductibles, co-payments, or co-insurance. In essence, Medigap's helps your healthcare costs more predictable by paying a portion of what original Medicare doesn't pay. So this is where it starts to get a little confusing, right? Part C, known as Medicare Advantage, is an alternative to Parts A and B that bundles several coverage types, including Part A and Part B, into one plan and often includes Part D prescription drug coverage. It may also include vision, dental, hearing, and other benefits. Medicare Advantage plans work to limit your out-of-pocket costs while providing access to other essential health and wellness benefits. Part D is a Medicare drug coverage for people with Medicare that helps lower costs of prescription drug coverage. While optional, you must enroll by a certain deadline to avoid penalty costs added to your original Medicare premium. Both Part C and D are run by private insurance companies, and each plan is approved by the federal government. Cost and coverage types vary by provider. You must first be enrolled in both Medicare Parts A and Medicare Part B before you can enroll in a Medicare Advantage plan or a Medicare supplemental plan. And you also need to live within the plan's service area and be a United States citizen or lawfully present in the United States. An easy way to remember this is you must have A and B to get C and D.
All right. That was a whole lot of information. I just want to let everybody know that everything that we've talked about today will be available for you to listen to and to read about after we're done with the webinar today. No need to memorize, and will still be available for questions long after the webinar is completed.
Great.
Um, there are several steps you can take to put you on the path to find the best plan for your needs. Mitch, tell us more about what our audience should be thinking about as we head into the annual enrollment period.
Well, first, it's important to check that your insurance covers the county where you live. Almost all insurance plans are county specific. Additionally, we understand that managing a chronic condition while finding the right plan can be challenging. Certain Medicare plans may offer enhanced support for managing your chronic conditions, including improved condition of your care and likely even more affordable medication costs. These plans are designed to work with you and your trusted primary care provider to help manage your overall health and wellness. For those tuning in, I want you to take out a pen and paper and write down these important considerations. Ask yourself key questions such as, what are my healthcare needs now and possibly in the future, including considerations around my chronic condition? Some examples of chronic conditions are heart disease, diabetes, and COPD. Next one, can I stay with my current preferred doctors? And are my hospitals in the plan's network? Does my provider create a personalized health and wellness plan tailored to my needs? What are my prescription drug coverage needs? And are my current prescriptions covered by the plan? Also, think about additional benefits and whether they are included in the plan that you choose. Dr. Barrett, you're meeting with patients all the time that have Medicare coverage. Why are these questions so important to them to answer so they can find the best plan that fits their needs?
Thank you so much for your information. One of the biggest um, concerns that they're receiving ongoing care, and then by accident, they switch to a plan that does not cover their current doctors or their current primary care provider. And since the annual enrollment period is only during a particular couple of months, they're stuck with the plan once January 1st hits. And so they may have to, for a whole year, takes time to get settled back in. So it's really important that the plan you choose is covering your current doctors, your current medications, at hospitals that you're used to going to.
Very well said, Dr. Barrett.
If you, Thank you. If you have questions about the annual enrollment period or what Medicare plan is best for you, check out Village Medical's helpful resources on our website to learn more about your Medicare options. The web information is right there on the slide. So you are welcome to go to that after the webinar, so you don't miss out on our information we're giving you today. Um, and additionally, for more information on Medicare and your plan options, you can go to medicare.gov or call 1-800-Medicare. The Medicare counselors there are really helpful answering questions about Medicare in general. They are not insurance brokers, though they will answer your questions. So the most important resource to help you find the right plan are speak with an independent health insurance agent like Mitch, search on medicare.gov, or talk to your primary care provider, and they can direct you to a local Medicare broker who can help.
There are many priorities and needs to think through when picking the right plan for you, right? This plan includes your lifestyle, your travel plans, personal finances, future needs. And one we want to focus on today with Dr. Barrett is your current health condition. Dr. Barrett to pick the right plan for their needs.
Sure. So I have sort of an example patient. So one of my patients, hypothetically, has diabetes and heart disease, and has a pacemaker device. It's really important that she is able to follow up with her regular cardiologist, as the pacemaker needs to be read periodically. And it's really important that she follows up with her regular endocrinologist because her diabetes is severe and needs very careful care. In addition, it's really important that she's able to stay with her primary care doctor who knows her well and is within a system like Village Medical, where we have a group of staff who are who are dedicated to the patient and dedicated to her, making sure that she doesn't have to go to the hospital all the time, because we're providing that really detailed, personalized care for her. Go ahead, Mitch.
Certain Medicare plans may offer enhanced support for managing your chronic conditions, including improved coordination of your care and likely even more affordable medication costs. These plans are designed to work with you and your provider to help manage your overall health and wellness.
All right. To show the importance of picking the right plan for your needs and priorities, we wanted to share on the screen what different Medicare options could look like. Between original Medicare and Medicare Advantage, there are unique differences. Mitch, can you share more on this?
Absolutely. On cost, for one, right? With original Medicare, once again, A and B, you'll pay your monthly premium for Part B. And after you meet your yearly deductible, you may pay 20% of your coinsurance or copayments. You may also have a monthly premium for Part D if you are participating in a Medicare drug plan. There is no yearly limit on out-of-pocket costs. With Medicare Advantage plans, you'll pay the monthly Part B premium. So on both of them, you're going to pay the monthly part, the Part B premium, as well as the monthly premium for the plan that you choose. Some plans offer zero premiums while others have a monthly charge. Most Medicare Advantage plans include Part D drug coverage at no cost. There's also a maximum out of pocket, otherwise called the MOOP, that limits what you will pay for covered medical services in a calendar year. On coverage, original Medicare covers most medically necessary services and supplies. It does not cover some services such as routine or annual physical exams, or routine vision, or hearing, or most dental care. Original Medicare does not have traditional network. This means you can see any doctor or hospital that accepts Medicare anywhere in the US, whereas Medicare Advantage plans will cover medically necessary services. Plans may offer additional benefits that original Medicare does not, as mentioned earlier, such as dental, vision, and hearing. With Medicare Advantage plans, you will have a network of doctors, specialists, hospitals, and other healthcare facilities. Reviewing these plans, understanding your priorities, and walking through the questions we highlighted earlier can be helpful as you choose the right Medicare journey for you. This is just a snapshot of considerations to think through when picking a plan. Check out Medicare.gov for a full breakdown of plan differences. Remember to speak with a health insurance agent like myself, or search on Medicare.gov, or talk to your primary care provider like Dr. Barrett to learn more. A great broker will ask you detailed questions about your health, your providers, your specialists, your prescriptions, and anything else that impedes your ability to carry out your doctor's suggested care plan so that they can match you to the plan that works best for you.
Great. Now let's take a step back and answer some questions for you, our audience. If you have a question you haven't asked yet, please be sure to drop it in the Q&A box at the bottom of the screen. All right. So here are some questions. Mitch, what changes are coming to 2026 to Medicare?
I won't cover all that because that goes for quite a while, and I know we're on a time limit. But in
Okay.
26, Medicare is implementing several changes, particularly with Medicare Advantage and Part D prescription drug plans. These changes include out-of-pocket thresholds. The out-of-pocket threshold for the Part D will increase from 2,100 in 2026 up from $2,000 in 2025. So it is going to jump $100. Medicare is also looking at price cuts on top medications, potentially reducing costs for seniors.
All right. And then a lot of patients have questions about prior authorizations and things like that. And I understand that you'll be able to answer all of those questions on an individual basis if people call you during the enrollment period to get assistance in signing up. Is that right?
That's correct.
Perfect. Um, Here's some questions from our viewers. Question is, when should I enroll in Medicare if I'm still working past age 65 or covered under my spouse's employer plan?
Great question. You can delay enrolling in Medicare Part B without penalty as long as you have what they call credible coverage through your employer's plan. You have a special enrollment period to enroll in Medicare once that employer coverage ends. The SEP starts when you or your spouse stops working or when your group health plan ends, whichever comes first, and it lasts for 8 months.
So, Mitch, you mentioned that there can be a delay in starting in signing up for Medicare Part B, but what about Medicare Part A? Uh, should the person enroll in Medicare Part A at age 65, even if they are covered by their employer's insurance?
Absolutely, because Part A is there's no cost to Part A, right? And it doesn't commit you to anything. So, if you choose to stay on your health insurance through your employer, that's a wonderful thing, and a lot of people choose to do so. And when I talk to them, I just want to make sure they understand the difference between the two, right? Regular health insurance itself for folks under 65, much like myself, I know I don't look like it, but regular health insurance itself, obviously you pay a monthly premium for it, much like you would for Part B if you was to take it out. And even if that monthly premium is, let's say less expensive than my Part B at 185, is it better insurance than what I get on Medicare, right? And that's a question a lot of people ask. Me personally, I lean towards Medicare. Uh, on typical health insurance, everything's itemized, right?
Mm.
So you go to the hospital, you're going to be paying for the hospital stay, you're going to be paying for your MRI, your CAT scan, every pill that they give you, so on, so on. Whereas with Medicare, it's not like that. You have a copay that you pay. So, for example, if I go to the hospital and I spend, a couple days in the hospital and I have an MRI and I have the x-rays and I have all that, it's typically all rolled into one copay, right? So to me, even though the premium may be a little more than what I'm paying at my employer,
Mm.
is it still more economical to stay on that employer insurance?
That's such great information, Mitch. That's a common question that my patients have asked me is, do I need to sign up? And it sounds like it's a very individual. So I imagine that you're extremely helpful for folks in that situation where they're still working and whether they should continue to pay for the employer plan or if they should switch over to Medicare.
Very true.
All right. Next question. What are the penalties for late Medicare enrollments? Nobody wants penalties, that's for sure. How can I avoid uh, being fined or getting penalized.
Well, and I hear this one a lot, and I see folks that are actually paying that penalty because they just were never educated on it, right? Late enrollment in Medicare can result in lifetime penalties added to your monthly premiums.
Wow.
For Part B, the penalty is generally a 10% increase for each 12-month period you delayed enrollment. The Part D coverage penalty is calculated as 1% of the national base beneficiary premium for each month you didn't have credible coverage. To avoid penalties, enroll on time during your initial enrollment period or during a special enrollment period if eligible. So we're going to back up to that again, right? So we know that we're eligible for Medicare 3 months before the month of our birthday, the month of our birthday, and 3 months after. That's our window, right? So we want to sign up anytime we can in that. If you're with your employer and you have what they consider credible coverage, then and only then you can, prolong signing up for Medicare. So it's
Okay.
a little bit different. But overall, that's the gist of it. Just keep in mind, it's all based around your 65th birthday or when you decide to sign up at a later date for Medicare.
Great. Another common question, are dental, vision, or hearing benefits included in Medicare, or do I need additional coverage?
All right, so I'm going to swing back to kind of what we talked about before. Make it simpler, right? Because I know this is kind of overwhelming and it's confusing and it's a lot of information to take in at one time. But I think the easiest way that I can describe this is when you turn 65 and you have the 3 months before, the month of, 3 months after to sign up for Medicare. Obviously, I'm going to choose to do that unless I really like my credible coverage, right? Um, I think my choice should always be the 3 months prior to the month of my birthday. And the reason I say that is when you sign up for A and B, that's called traditional Medicare, right? Traditional Medicare, folks, you have to remember that traditional Medicare does not include your Part D, your premium drug plan. It doesn't include benefits like dental, vision, or hearing, right? It comes with a premium or with a deductible. And so after you pay that deductible, you're responsible for 20% of all your costs, all your medical costs moving forward for that year. Um, if something devastating happened to you, I mean, that adds up really quick, right? And with traditional Medicare, there's no cap, there's no maximum out of pocket that you can spend. It's endless, right? So more folks, can go bankrupt on traditional Medicare than any other type of Medicare. Now, traditional Medicare is great for, say, for example, a veteran that has his needs taken care of at the VA and he gets his prescription drugs through the VA. But typically, most people are not going to choose to stay on traditional Medicare, which leaves you the two other options, right? Do I get a supplement? A supplement is when I go to a private insurance company and I pay them X amount of dollars per month to cover that 20%, right? The benefit to that is, hey, it pays almost all my co-pays and my co-insurance, right? But I have to pay that monthly fee for that service. So I'm paying my Part B, I'm paying, my monthly for this 20% to be covered for my supplement. And then I still have to take out a Part D because it doesn't include a Part D. So, now I'm up to three supplements. And if I want dental, vision, or hearing, I got to pay for those too. So that's the downfall of a supplement. But the positive to the supplement is, man, you know what you're going to pay each and every month. So it's easier to predict your cost out of pocket. And your network is all throughout the US. Anybody that takes Medicare. I mean, that's the benefit to a supplement. The other option is our Medicare Advantage plan, C and D. C and D, typically, just depending on what plan you go with, is not going to have, I mean, most of them have a zero monthly premium. So you're not paying additional money. You're paying that Part B 185. But your premium for the plan itself, for C and D, as we call it, Most of them are zero cost, and if not, they go up to maybe $100, just depending on which one you choose. But the benefit to that is it includes your dental, your vision, your hearing. It includes your prescription drug plan, right? So it's a much more rounded program. But it's there's an option for everybody out there. You just have to choose which one fits best for you at this time.
All right. Fantastic information. Um, Couple of questions that are coming up in our question and answer series. A lot of people are asking, um, what should I do with signing up for Medicare Advantage plans as compared to signing up for the marketplace plans, the Affordable Care Act plans?
Well, that's real simple. First of all, ACA or Obamacare or Health Market, whatever you want to call it, marketplace, that's for 65 and under. So once you've aged 65, you're going to have to either go on Medicare or be on credible coverage. You cannot continue on a marketplace plan. And depending on what you make, marketplace plans can be very costly.
Okay, we have some questions from folks that are turning 65 this year. Um, and there's a question of, okay, if I sign up for Medicare uh, around the time of my birthday, do I have to also go through the annual enrollment?
No, you have a special election period when you turn 65. That's that 7 month period. That really doesn't have anything to do with AEP, right? AEP's for folks that are already on Medicare. So no, you have a separate SEP, special election period when you turn. Now, once you get on a plan, and let's say for example, you get on a plan in March or April because that's when your birthday was. When it comes down to AEP, should you make a change? And I'm going to say it this way, every plan changes every year, right? And it's in everybody's best interest to look at the changes each and every year. And that's something that we really thrive on is learning the differences, what's new in 26, which plans seem to, offer more. And that's where you would consult, somebody such as yourself or even myself, and we'll help you through that process.
Great. Another question I think is interesting is what if I sign up for, I have a qualifying event and I sign up for Medicare Part B or the Advantage plan, and then later I'm employed, can I switch from the Advantage plan or Part B over to my employer plan?
Yes, absolutely. There is, you can do that, but typically, once again, it's going to depend on your condition, your circumstances at that time, what the plan's going to cost through your employer. You'll want to do a detailed comparison, benefits, the whole bit, what's covered,
Mm.
before you make that determination. But absolutely, you want to do what's best for you.
All right. I think we have time for a couple more questions. I'm scrolling through y'all's questions. Some of you have asked similar questions, so I'm trying to combine. Another question was that um, my employer has a PPO insurance for their retirees. Is there an advantage of that over the Medicare Advantage plans?
Once again, that's going to come down to a comparison, right? You're going to want to compare what that PPO plan is through your employer, and you're going to want to compare that against the plans that are available for Medicare and figure out which one's best for you. And there's a lot of things that you have to compare to look at that, but that's obviously something you want to check into, and that's where we come in to help you out with that as well.
Okay. And then another common question is, okay, if I delay enrollment because I have credible coverage, do I have to prove it to somebody that I have credible coverage so that I don't get penalized?
Yes, yes. So when let's say I'm 70 years old, I've stayed on my employer health insurance, it's considered credible coverage. So when I go to apply, for my Part B, so I can get a Medicare Advantage plan or a supplemental plan, Medicare will ask you for proof of credible coverage. And there's a letter that your employer will draw up and you'll submit that letter. And as long as you had credible coverage during that time, there will be no penalty.
Great. This is an interesting question that I think you could answer. There was a question from someone who is the guardian for their grandchild, okay, and they're concerned about switching from the Affordable Care Act to Medicare because they'll have to pay an additional premium to cover their grandchild. Do you have any information about that? If we have a dependent?
Well, yeah, yeah. I mean, if you add a dependent to marketplace, there is a price that comes with that. Absolutely.
Mhm,
Um, but once again, to me, Medicare, if I'm the one eligible for Medicare, I'm probably much better off to take the Medicare, pay
mhm,
the 185 than what I was planning marketplace, but it all depends on, once again, your condition. That price on marketplace is driven by your income, what you're filing at the end of the year for your
mhm,
taxes. And if you don't have a huge income, then you get a pretty good policy. You get a good supplement or whatever. But,
mhm,
if you have a high income, they're going to be more costly and you may be better to go to Medicare. So
mhm, mhm.
it absolutely depends on your situation, and everybody's situation is different.
Got you. So it sounds like for folks who are eligible for Medicare, and they have dependents who need to be covered under the Affordable Care Act, it sounds like it may be better in general to have the Medicare Advantage for yourself and ACA coverage for the dependents. Does that sound
That sounds
correct?
correct.
Okay,
Yes.
great, great. Um, Another question. I think we have time for one more, and that is going to be. So what if I didn't sign up uh at age 65? Like I didn't know that uh
That you could.
so this question specifically, if electing to delay Medicare until age 70 because I'm still working and covered by employer plan, is there a different enrollment period beyond the 7 months previously mentioned? So I
Yeah,
guess the question is about enrollment period after I'm not under on my employer's plan anymore.
that's true. So when you choose, let me find where I'm talking about this, but absolutely, you have your own election period. It's an 8-month period. And then you can switch during that 8-month period. It's called an SEP. So once
Mhm.
again, you have a special election period that allows you to switch during that time. And I guess what a lot of folks don't understand is you can still continue to work for your employer and still be on Medicare. You don't have to be on that employer plan unless it's beneficial for you.
Great, that's great news. Okay, as we wrap up, let's hear from you again about what we discussed today. So this is the same questions. Oh, sorry, not the same questions. I apologize. Um, how are you feeling now about Medicare annual enrollment period after we've given you some information, answered some questions? You feel hopeful, informed, wanting to learn more, or you're not really sure?
We're more confused than ever.
All right. Great. Well, we're glad to hear that people feel like they got some benefit from today's event. And again, there's still lots and lots of information out there for you, and we'll give you some of those contacts. So thank you so much, Mitch, for joining us today. We really appreciate you sharing all this information. And we know that you have lots more information. So if you feel like If you'd like to speak to Mitch directly, please contact him at 832-731-0508 or by email at mitchirwin@fovinsurance.com. Website is www.fovinsurance.com.
Thank you, Dr. Barrett.
Great. And thank you so much for attending. On behalf of Village Medical and FOV Insurance brokers, we thank you so much for attending today's webinar. We really hope that you found it valuable. As a special thanks to my fellow speaker, Mitch Irwin, for joining me today. Your voice matters to us. Please take the post-webinar survey at the end of the event and let us know how we did. That way, when we do this next time, we'll make sure that we have the information that you need because we are here to serve you. Thank you and have a great rest of your day.